Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're back and to support you as you continue on your journey towards CNE certification, or perhaps you are here because you want to become a better nurse educator, or you are on a journey to renew your certification. Whatever the reason you are here, just know that we are here to support you until you are successful. If you haven't already, go ahead and subscribe to this channel so every single time a new episode is released, you'll be notified right away. The second reminder is to go ahead and print out your study worksheet. Remember that every time you show up for an episode, we want you using your study worksheet, okay? We have determined that that is a key contributor to success on the CNE exam, and there's data that supports that. Research tells us that when we write down content, yes, with pen to paper, we are more likely to remember it. Now, if you're like me, I take a lot of notes on my laptop. And even though that may be more productive as far as capturing the important reminders that we want to capture when we leave that webinar or when we are attending that conference, there's more value in us being able to retain that information when we write it down. So that's why we want you to print out that study worksheet every time you tune into an episode. And the second reminder is to go ahead and pull out your resources. All right, we are going to be using Billings and Halstead Teaching and Nursing as our primary resource. We are still using the 6th edition. We know there's a new edition coming out, but it hasn't yet. As soon as we find out about it and NLN adopts it, we will let you all know. We are continuing on our journey and looking at the role of the clinical faculty member and what are some key characteristics that they have to be able to demonstrate when they see questions on the CNE clinical exam, or if you are on the journey to CNE, do know that there are questions that you can expect to see there as well. Okay, in fact, we know that for the SAE, there can be several clinical faculty questions on the exam. Okay, and when we use the term clinical faculty, it just means that we're more likely to have that encounter with the student in the clinical setting. Okay, it's not necessarily by title, it's more of situation. All right, so just keep that in mind as well. So Billings and Halstead, I want to go ahead and give you the references that you want to take a look at, the specific page numbers. Okay, we're going to be talking about case studies, so make sure you take a look starting on page 297. You're going to see some teaching tips about case studies as well as advantages and disadvantages that are associated with case studies. We know this is a wonderful way to integrate active learning into our classroom. All right, and then the next page I want you to take a look at is if curriculum is still a muddy point for you, especially as it relates to the integration of clinical judgment and how we assess students' learning to determine how we modify our curriculum, I want you to start looking on page 107. That gives you a great introduction to curriculum, how it's developed, which components you want to consider, the types of curricula, and how you align your curriculum with the stakeholders' advantages. What we want to happen is our students to graduate on time, to matriculate through our program, to successfully pass the NCLEX, and to have a solid foundation that they're able to build on as they bridge from the education setting into the practice setting. We call that practice ready nurses. All right, so that is going to be our focus for this session. So we did a little different today. We gave you the references up front. So hopefully you went ahead and captured that on your study worksheet. Clinical judgment. Now, we've heard from Dr. Gixick-Neiman and Dr. McMillan-Bowler during our summer series about the role of storytelling and clinical judgment, as well as social determinants of health. So if you didn't catch their episode, you can go ahead and head over to our website, and we have the summer series recordings available for you as well. All right, so we're finishing number 10 summer series on Saturday. All right, so you may be watching this video after that has already happened, but no worries, the recording is available if it is content that you want to take a look at. So clinical judgment and learning needs assessment for curriculum development. All right, so that is our focus for this episode. Effective curriculum development, it requires a deep understanding of our learners' needs and their ability to utilize clinical judgment. All right, so how do we determine what those clinical needs are, or how do we assess students' understanding and comprehension of these important concepts? All right, so let's take a look at our thought-provoking question for this episode. What role do case studies play when it comes to active teaching strategies for nursing students? So we have 4 choices. They help prepare for simulation scenarios. They are least effective when they are complex. They bridge the gap between theory and practice. And the 4th option is they focus more on theoretical concepts. All right, so take a minute to think about those 4 choices and which one do you think is most correct. And remember 2 things when you sit for the CNE exam. Number 1 is think about, what is the question asking? Okay, we know from time to time we can hear feedback that there were a lot of clinical questions on my CNE exam. We maintain the integrity of the exam. We never asked for specific questions, but we're always curious if there were surprises on the exam. And here's the good news. Consistently, we've heard from the majority of nurse educators that we support that they felt prepared for the exam. They may have perhaps went into the exam with some muddy points or some gap areas, and they have worked to close those gap areas. It's just a matter of whether or not they were able to pull from their direct experience to answer the questions, because remember, about 80% of the questions may be from the application or analysis levels of Bloom's taxonomy. Okay, so when you think about that, yes, we want to have that solid foundation in understanding the concepts, but we must be able to apply them. Just as we are talking about case studies, specifically with unfolding case studies, we know that students have to be knowledgeable about the concepts in order to even think through how to connect the dots and how to make safe patient care decisions as the case unfolds. All right, so just think about what the best answer is based on the information you have. The explanation of the process of learning needs assessment. We want to determine the gap. Just like your journey right now, our students are on the same journey. We bring our students into active learning strategies to be able to engage with them in a way that's going to help them take the leap, right? We want them to take the leap by raising their hand, by asking questions if there's a muddy point, and we want them to be self-directed by giving them the resources, just like we talked through teaching and nursing, Billings and Halstead. We want you to go to the primary source to determine what information you need to pull from in your textbook to close your knowledge gaps. We want to see scaffolding of learning over time. Yes, we identify our students' learning needs early, but we want to be able to map out a plan generally aligned with our learning objectives to frame the course content and to expand on it as we build on the course week over week. I know many of us are starting the fall semester, and it's a busy time right now, so I appreciate you all jumping in to watch this episode, especially if you're watching it when it's released. So again, reach out to us if you have any questions, if you're watching this as a replay. But just think about, as we're building on our content and our courses, as we are developing that teaching plan, our goal is to close that gap, to bridge that gap between theory and practice with our students. So how do we know what the learning needs are? How do we know what those gaps are? Well, first, we can use evaluations or surveys. We evaluate our students in so many different ways. First, of course, is exams. We also evaluate them and hopefully do quite a bit of formative evaluation when we think about discussions, right? When we think about reflections in the clinical setting, we're constantly collecting data. We're interviewing our students. Essentially, that's what we're doing, because we're having conversations with them. We're looking at their body language. We're listening to what they say, especially in the clinical areas. We're doing focus groups where we're pulling students together, whether that's during the pre-conference or the pre-conference session before the simulation or before the clinical experience. And then we're doing a debrief or a post-conference or a post-simulation conference where we're talking about, what do students learn? We're showing them the video if it's simulation, and we're giving them formative feedback so they can make adjustments and improve their clinical performance. Our target audience and what their learning needs are. We have lots of stakeholders when it comes to our journey that we go on with our students to close their knowledge gaps. First is going to be the student themselves. We're looking at our program outcomes. We're aligning them with the university's mission to serve the community and provide a quality nursing education experience with our students. We are gathering feedback from our alumni when they graduate. How well did you feel prepared for the clinical setting? We're gathering data from our healthcare partners. How well did our students perform post-graduation? Were there some skills that you identified that perhaps we could have strengthened within our curriculum? All right, so those are all the considerations when we think about our curriculum and what key elements we want to focus on. And then last, when we think about clinical judgment, because there is scaffolding of learning that not only happens in every course, but semester to semester or term to term. So we want to think about course sequencing as well, especially for these clinical courses, because we want our Med-Surg 2 student obviously to have stronger skills and be able to make more independent decisions using critical thinking and clinical reasoning as they move forward in the clinical setting to provide safe patient care. So if you chose C as the answer, you are correct. So give yourself a round of applause. We are looking to bridge that gap between theory and practice. So let's talk about why the other choices were incorrect. First, with A, they help prepare for simulation scenarios. Well, that is not the goal for case studies. As you look on page 297, and there are a couple of pages that are important in Billings and Halstead for you to focus on. If you don't have clarity around the role that case studies have in active learning, I encourage you to just take a look at the index page in Billings and Halstead, and you're going to see a lot of different references. And let me talk about one that I really like for case studies, and it's on page 398. This is a table that I think is very eye-opening when you think about what the role is that case studies can have in really engaging students in the learning process. So on page 399, table 21.2, this is where you're going to see a lot of descriptions around how we're able to adapt teaching strategies with various synchronous technologies. That's what table 21.2 provides. So you'll see at the very bottom, case studies and simulation. It helps individuals to weigh and test values, separate fact from opinion, and develop critical thinking skills. All right, so when you think about B, they are least effective when they are complex. It's the opposite. They are most effective when they are complex, and that's for case studies. And we know case studies do not focus more on theoretical concepts. Are there theoretical concepts involved? Absolutely, because that's the foundation, that cognitive learning piece. And then we're integrating affective and psychomotor learning domain through the use of case studies. We hope this episode has been helpful. Until next time, you can reach out to us on our website or send us an email, info@drsellerseducate.com. Thank you for joining, and we'll see you next time. Have a great one, everybody. Bye-bye.